Welcome to The Scoop, NANP's monthly educational webinar series. I am your host, Andrea Granson, Educator and Program Specialist for the NANP. These webinars are recorded and can be viewed at any time by logging into the NANP members area. NANP members can earn one continuing education unit for participating in the Scoop webinars by taking the corresponding quiz, which can be found in the membership area of the NANP website. Okay, so let's get started. Today's presentation is Lyme disease and co-infections using plant-based options with Dr. Jodie Dashore. Dr. Jodie Dashore is an internationally recognized practitioner, author, researcher, and a pioneering clinical herbalist. She is widely known for her pioneering work in the world of plant-based medicinal approaches to autism, Lyme, biotoxin illness, and chronic inflammatory response syndrome, and Camel Milk medicinal protocols. Dr. Dashore holds a PhD in integrative medicine, is a CIRS shoemaker certified practitioner, board certified in integrative pediatrics, is a board certified and licensed doctor of occupational therapy, board certified holistic health practitioner, and a registered herbalist with the American Herbalist Guild with over 25 years of clinical experience. She specializes in all natural, plant-based, and individual genetic-based customized treatment options for autism, Lyme disease, and mold/biotoxin illness. She is the founder and director of Bionexus Health Clinic, which is dedicated to scientifically formulated plant-based treatment options, along with therapeutic camel milk protocols for patients of all ages. Dr. Dashore comes from a multicultural background, is well-traveled, and is able to seamlessly work with families in over 50 countries worldwide, utilizing local resources, dietary nuances, and honoring cultural traditions. Dr. Dashore is currently pursuing a postdoctoral certification in immunology at Harvard Medical School and is the author of the book, The Bionexus Approach to Biotoxin Illness, a step-by-step guide to sustainable plant-based treatment options. Welcome, Dr. Dashore, and thank you for joining us today. It's over to you.
Hi, Andrea. Thank you for having me.
Thank you.
All right, folks, let's proceed. I hope everyone can view my screen. I'm going to share the PowerPoint and we shall proceed accordingly. So today we'll speak about herbal formulations, essential oils as treatment options for tick-borne infections. And we'll be focusing on foundational elements, detoxification, antimicrobial herbals, essential oil combinations, along with, there are specific herbal and essential oil combinations that work really well. I'll be touching base on those, as well as a little bit about camel milk therapeutic protocols as well, right? So let's begin. I always start with a prayer of thanks and gratitude to my amazing mentors, Dr. Jemsek, Stephen Buhner, Dr. Jones, Dr. Shippen, herbalist Marg, and Crow. I really appreciate the guidance over the years. Many of you who know me know that it's been quite an arduous personal journey as well to reach where I am today. And I will be discussing tick-borne infections in depth. So most of you watching understand that it can be a very insidious and complicated condition, right? So let's begin with the most well-known tick-borne infection, that is Lyme disease. Now, what is Lyme disease? Lyme disease is a vector-borne illness, and most people know it as being transmitted by a deer tick. Okay, there are other insects that can transmit Lyme disease and co-infections as well. A couple examples would be fleas, chiggers, sandflies, horseflies, spider bites. The first things that usually come to surface would be symptoms like fatigue, flu-like symptoms, and approximately 20 to 30% of people will see a bullseye pattern rash. The acute symptoms, there is usually a circular expanding red rash known as the EM rash or erythema migrans. There's going to be flu-like symptoms with or without the rash. Oftentimes as tick activity is at its maximum during spring and summertime, it is you will see patients talk about getting flu in the middle of summer. So one of the important diagnoses that you should keep in mind is Lyme disease. Now, symptoms will include lack of energy, headaches, stiff neck, fever, chills, muscle and joint pain, swollen lymph nodes. In some cases, the person doesn't notice any symptoms at this stage, right? Obviously, not everybody gets Lyme disease. It all depends on numerous factors, age, immune system status. I've noticed in my practice that athletes are able to handle Lyme disease. They have minimal symptoms. I have professional as well as varsity athletes on my caseload, and we see that every test comes back like seriously positive, right? For co-infections, for Lyme disease, the lab test like lights up like a Christmas tree, and they have no symptoms. They're just cruising through life, doing their sports, taking care of their families. So yes, athletes do seem to have an advantage. Now, also keep in mind, athletes also have excellent diet and nutrition, don't they? All right. These are a few symptoms of early disseminated Lyme disease infection, which would be approximately 1 to 6 months. I mentioned about the erythema migrans. Additional rashes may appear on other parts of the body. Now, many of you watching are nutritional professionals. So keep in mind that many of your clients or you yourself may accidentally or erroneously attribute the rashes to a histamine reaction or a food reaction, and that may necessarily not be the case. So please dig deep and ask the important questions. Additional symptoms would be pain, weakness, numbness in arms or legs, right? Similar to neuropathy type symptoms. Not being able to use the muscles of the face. Sometimes you will see Bell's palsy on one side of the face. Headaches, vertigo, fainting episodes, poor memory, reduced ability to concentrate, sometimes conjunctivitis. You might also have patients who complain about rapid heartbeats, palpitations, and rarely, so far, in the last decade, I've had 5 patients only that have developed serious cardiac issues or heart issues. Okay, these are the symptoms of late stage, also known as neuropsychiatric Lyme, right? But as you can see, it is physical as well as neuropsychiatric symptoms at late stage. For myself and my son, we had discovered Lyme disease and co-infections, unfortunately, at this stage. So arthritis that most often affects the knee. For me, it was my finger joints. For my son, it was his hip joints and entire pelvis. But typically affects the knee. Then there is the neuropathy symptoms that I mentioned earlier, the numbness, tingling, hands, feet, back. Some patients complain about vibratory feelings anywhere in the body, exhaustion, not being able to control the muscles of the face and or the body, involuntary twitching of the muscles, problems with memory, mood, sleep, learning, decision-making, sometimes problems speaking, as in slurring of speech is possible, also word recall, right? Cardiac problems, it can be as simple as, I mean, I know it's not simple, but it can range from panic attacks to actual myocarditis or pericarditis, which would be inflammation of the structures, surrounding the heart, or inflammation of the heart itself. The common co-infections that coexist with Lyme disease, they can often be transmitted by the same insect bite. There's a long list. The most common are Babesia bartonella, Ehrlichia, Anaplasma, Rickettsia, but it's also important to look at the rest of them, because there are multiple bacterial, viral, fungal, and parasitic opportunistic infections that happen when you have tick-borne infections because of the effect on the immune system. So let's talk about that right now. Lyme disease, you may have heard that there really isn't any cure from Lyme disease. And what does this mean? Well, that's true. Lyme disease can be put into remission, roughly similar to having a cold sore. The virus goes to sleep or goes into remission, and the next time there is a stress or a fever, cold sores are sometimes known as stress blisters or fever blisters. That is when the virus resurfaces and you see the blister. Similar to that, Lyme disease can resurface during times of extreme trauma to the body. And for example, it would be divorce or death, or emotional upheavals like heartbreak, or it could be a physical issue, for example, like mold exposure and the associated biochemical and physiological changes that occur in the body can definitely, reactivate your Lyme disease, along with any major physical trauma, like a car accident, for example, right? Now, the spirochete, which is the Lyme disease bacteria, they may survive intracellularly, extracellularly, or in body fluids and tissues. This is where they hide. This is the reason for persistence and pathogenicity of BB being, Borrelia burgdorferi. That is the most common species of Lyme. Nowadays, there are several other species of Lyme, like Borrelia recurrentis, Borrelia miyamotoi, that have been identified. There are tests available as well. One thing to keep in mind, though, is testing for Lyme disease is available. There are blood tests, there are urine tests available as well. It will depend on the expertise and experience of your practitioner as far as interpretation of the tests are concerned, because Lyme disease and co-infections, they affect the immune system, right? So immune system is what produces the antibodies. If the immune system is dysfunctional, suppressed, the antibody production is affected, the detoxification mechanisms are affected, and that is reflected in your lab testing, in your lab results. That's why keeping in mind the immune system reactivity to Lyme disease is important during interpretation of any kind of labs that are done, right? This slide tells you about the four forms of the Borrelia burgdorferi spirochete: the L form, the spirochete form, the cyst form, and blebs and vesicles. Right. The mechanisms of persistence would be: 1, active immune suppression; 2, immune evasion or induction of immune tolerance; 3 is actual physical seclusion. Long story short, Borrelia burgdorferi, or the Lyme disease spirochete, no matter what species, is a very smart organism. Needs to be treated with respect. And again, make sure that you have adequate tools in your tool belt to be able to treat a patient with either acute or chronic Lyme. Most of us will end up seeing patients with chronic Lyme. That has been my experience. Acute infection, if it is discovered by their primary care, is usually treated like any infection would be, right? With antibiotics. However, I do have several people who absolutely prefer a naturopathic approach. So I see all kinds of cases. I've had newborns that I've had to treat that have been born with Lyme disease. You may or may not know, but Lyme disease is sexually transmitted. It can be sexually transmitted. It can also pass from mother to child in utero. So again, ILADS.org, the International Lyme and Associated Disease Society, has a lot of clinical evidence on all of these. So for those of you, who are left brain research oriented, there's plenty of papers to look over if you need, any additional information. So this slide tells you some proposed mechanisms of Lyme disease persistence. As I mentioned in the previous slide, there is active immune suppression. So as you can see, the two halves of your immune system, right? The innate immune system and the adaptive immune system. The innate immune system, these are the mechanisms that are used. And the adaptive immune system is also affected, and I have highlighted, I've highlighted the mechanisms that are used. Now, immune evasion is phase and antigenic variation, right? It affects gene expression. That's on the left here. Then on the right, far simpler than that, is actual physical seclusion. It hides from the immune system inside the cells, inside cysts, and inside sites where immune system finds it difficult to patrol. Okay, let's go to the next slide. Now, oftentimes, like I said, patients, when they have acute diagnosis of Lyme, they get treated, they're given one antibiotic for a few weeks and said, okay, you're fine. But then, once that the medication is over and done with, they don't feel better. Some of them actually get worse. Now, what should you consider? So this slide tells you why a patient may not feel better after the initial treatment. Now we are looking at, underlying bacterial, parasitic, protozoal, viral, fungal infections. We are looking at heavy metals. We are looking at, cryptopyrroluria, exposure to mold, water damaged buildings. You may have a patient who has poor diet and nutrition. That could be one. And, as part of the poor diet, the compounds like glyphosate that are consumed as part of a non-organic diet, that may be increasing their toxin load, which further compromises the immune system and makes recovery that much complicated and difficult and arduous, right? Then methylation pathways the methylation status of a patient, right? If there are any single nucleotide polymorphisms or SNPs or mutations, as commonly known, that may affect the patient's detox pathways, the client's detox pathways. Then additionally, there are genetic susceptibilities to Lyme disease as well, right? So some physicians run the HLA-DR pattern for the patient to see what's going on underneath. Oh, we spoke about this. Sorry about that. I have to move to the next one. Right. So address the three components of Lyme and co-infections. Oftentimes this is forgotten, right? Only the first one is treated, and then you have a patient that comes back, with all of the problems, like I'm not feeling better, what I discussed in the previous slide. So what is important here? Don't just address the presence of spirochete and co-infections. Oftentimes the spirochete infection, which is the Lyme infection, that is what is addressed, and co-infections are neither investigated nor treated. Okay, and that is a huge mistake. So always look for symptoms and investigate for co-infections. In my experience, 100% of patients that I've seen, in over a decade of being an ILADS practitioner, Lyme literate practitioner, that every patient typically has co-infections. Simply, I explained the immune system interaction, the effects on the immune system of Lyme a few slides ago. So if you think about it, that is exactly what is the most important thing, is to look for what else is going on, what other infections this patient has. Okay, so treat those. But do not forget that infections produce toxins, exotoxins, endotoxins. Those have to be detoxed. Third, the immune reactions that are provoked by what? The toxins, as well as the infections or the microbes. So you have to address all three. It needs to be a proper tri-pronged approach: infections, co-infections, toxins, and immune system reactions. Okay, so address all three for best outcomes in your patient. All right, now I will not go into detail about nagalase. There's information there that you can refer to, but the only thing I wanted to mention about nagalase was look at nagalase levels for your clients if they have a lot of underlying virus symptoms, right? Or if the primary care has done any kind of testing, right? Patients often show up high for Epstein-Barr, for Coxsackie, for cytomegalo, HHV6, these different viruses. And once the viruses are treated, if the patient is still not feeling better, look for nagalase levels and address those. Okay. Right. Now, also look for mitochondrial dysfunction. Mitochondrial dysfunction symptoms are fatigue, edema, muscle stiffness, cardiac symptoms, and a longer exercise recovery, right? This happens due to gene expression alterations that happen, that I spoke about a bit earlier. Additionally, nutritional deficiency that occurs when there is infections and immune dysfunction. So it's important to look at mitochondrial dysfunction. Mitochondrial hypometabolism is known to occur in chronic inflammatory response syndrome, mold exposure, or biotoxin illness. And Lyme disease and co-infections are a very important trigger for biotoxin illness. Sorry, I don't know why I keep going back to this slide for some reason. Okay, here. Right. Hemocryptopyrroluria, or simply known as cryptopyrroluria, KPU, just like nagalase, is another important aspect to consider if your patient is not getting better, right? And I have given you details what KPU is. It's biological toxins from microbes block a few enzymes, and this leads to the production of cryptopyrroles. Now, these cryptopyrroles, hence KPU, cryptopyrroluria in urine, these cryptopyrroles deplete essential minerals in urine, and urine testing is available for KPU. So, it's a simple 24-hour collection, and you can see if your patient has KPU, which needs to be addressed in order for your patient to feel better. All right. Now, make sure that you check your patient's pH balance, because depending on what the patient's pH is, it might be encouraging bacterial overgrowth. There could be oxidative stress. And as we know, there is, with acidic pH, there is increased risk for cancer, toxicity, buildup of ammonia in the blood, and additional fatigue, often associated with mitochondrial dysfunction. Yes. Women with chronic Lyme, even men many times, because estrogen imbalance occurs in men and women with biotoxin illness. And as I said, Lyme and co-infections are a huge trigger for biotoxin illness, right? Because why? Because they produce biotoxins, don't they? So estrogen, progesterone, the photograph is just of a woman pretty much, with permanent PMS. In fact, I've heard wives say the same of their husbands, and we run labs on them, and the husband's estrogen levels are sky high. That's a complicated process of endocrine dysfunction that can happen with biotoxin illness. Aromatase is upregulated, estrogen levels will skyrocket for both sexes. All right, so estrogen, progesterone, testosterone, growth hormone, children with Lyme disease and biotoxin illness, growth hormone challenges. You'll often see, things like failure to thrive. My child has no appetite, he's not growing. Antidiuretic hormone, cortisol, epinephrine, norepinephrine, all of these have to be looked at. For children, also look at dopamine levels. Look for PANS pandas, because for children, Lyme disease and tick-borne infections are a huge trigger for PANS pandas type, type illness. Okay, now genetic mutations. There can be single nucleotide polymorphisms, methylation, detoxification mutations that can affect your ability to detox, that can cause problems with sleep and mood, interfere with immune function. And there are several that are evidence-based associated with chronic illness as well. So it might be helpful to run a methylation and detoxification panel for your patient, right? So as we all know, this is just the methylation cycle. Methylation is complex. Very, very important. Actually, the next slide will explain a little bit better. Methylation treatment can be tricky. I highly recommend put it on the back burner until all of the previous steps are done, right? Because if there is too little, there is, it's not desirable. If it's too much, it's also not desirable. The key is overmethylation is extremely painful for your client. Don't allow your client to go into overmethylated states. That is very easily done by enthusiastic practitioners, thinking that methylation is a primary focus of concern. It is not. Methylation, in my experience, should not be touched until the underlying inflammation has been addressed, right? And if the patient is not progressing, if your patient reaches a plateau, you've investigated KPU and nagalase and mast cell activation and mold exposure, all of that has been addressed. And then you see that, methylation seems to be a problem. That's when I would look into it, right? And additional clinical nugget here is, if it is a heterozygous mutation, I really don't pay a lot of attention to that, because, you can't give the body multiple crutches. You have to heal the body of infections and toxins, right? As well as any kind of immune dysfunction, and then allow the body to do its own innate intelligence magic. The body knows how to heal itself given the right tools, right? Nutrition, diet. If it is heterozygous, it means that 60% of the pathways are doing fine. Let the body adjust, let the body manufacture whatever it wants to manufacture on its own. Don't give too many crutches. If it is a homozygous mutation, right, 2 pluses, meaning they got a mutation from mom and dad, that is when a little bit of help till everything is regulated in the body, right? Till the body reaches homeostasis, that might be warranted at that time or at that point. Okay, so these are the 7 steps of the BioNexus approach. And let's proceed further. Nature's abundance, plant-based and all natural protocol options. Let's see, what do we have here? Very important slide, right? If you as a practitioner are suffering from Lyme disease and biotoxin illness, I would highly recommend having a colleague or another practitioner that is more experienced than you are. First, clean and clear yourself, right? Practitioner, heal thyself. Once that happens, then you'll find that you're able to help your patient even more, even better, right? Because nothing really hits home until it hits your home. That's something that I've always said, and nobody understands it as well as the person who has actually experienced it. So this is some dosage. Keep the slide, close to your treatment protocols. Take a printout, write it down, whatever works for you. Okay, step 1, we shall start with nutrition consideration. These are a few deficiencies that are seen in patients with chronic Lyme disease and biotoxin illness. So replenishment is called for. All right, organ support, liver, lymph, kidney, adrenal. I have given you some third-party supplement options as well as individual single remedy herbs. Right now, my recommendations here, again, these are broad spectrum. Those who know me know that I am a huge proponent of customized protocols. That is what seems to work the best. So these are options available. Evaluate your patient, know the supplements, and accordingly suggest a supplement protocol for your patient, right? So there are numerous options. All right, some options for binders and cholagogues. Check for mold exposure. Remember what I said, right? So cholestyramine and Welchol here are conventional. Sometimes you may find that the primary care doctor has prescribed those. Oftentimes they work, oftentimes they don't. I've actually seen patients with chronic illness can develop mast cell activation, and any kind of pharmaceutical medication, they're like too sensitive to that. All right, remember to address xenobiotics, heavy metals. My pediatric population need vaccine detox. Another interesting thing I found was, as far as vaccine detox is concerned, and I wouldn't have really thought about it before, if I hadn't gone through it personally, is that my immigrant population, right? People come to United States, they become naturalized citizens from all over the world. And one of the things in the processes of that citizenship acquisition process is they check your vaccine status, right? And they often make you revaccinate yourself before granting you that citizenship. Happened to me, complete disaster. Someone who grew up with minimum vaccine, nothing. We only got 3. And, again, those of you who know me know that I was born in Mumbai, or Bombay, as it was known back in the day, and we only got 3 vaccines. My mom was Greek-Irish, very holistically oriented, and the only thing we got was smallpox, polio, and tuberculosis, like gigantic diseases, made sense, and they were small batch manufactured real vaccines, right? Not the kind they have nowadays with, additives and preservatives and et cetera, et cetera. So it is interesting that a lot of people that have become naturalized citizens have had to go through multiple vaccinations, which are typically given in the same day. You go to the immigration doctor and he just pumps you with 6 or 7. Here you go, voila, go for your citizenship interview. Tomorrow you're all set. So keep that in mind. Okay. Gastrointestinal support, health and metabolic support. Most of you are nutritional professionals watching, right? Some might be from other walks of life as well, but this should be right up your alley. I've given you a lot of options here. Please have a look. Right? Remember to probiotics, rotate the probiotics, then anti-inflammatory supplements, digestive enzymes. Sometimes you may need proteolytic or fibrinolytic enzymes if there is, a systemic issue going on with the patient. We know that Lyme disease affects soft tissue. It begins to break down cartilage and soft tissue as well. Okay. All right, dietary modifications. These are some of the dietary modifications that I recommend. Mostly common sense, as you can see. One thing that's not here is, I don't have a slide on that, is detoxifying your life. Right? That is a very important choice to make. And, starting from the kitchen to every other room, right? Your laundry machine, your the shampoos, the conditioners, the cosmetic products, the body lotion, your laundry detergent. And when I said laundry machine, I'm not kidding. For those dealing with Lyme as part of biotoxin illness, it's very important. I have a YouTube channel called as Bionexus Health USA. And I also have a Bionexus podcast on Podbean. So, whether you want to listen or you want to see the video, like some of these, you need to see the video. So one of the videos that I've shared is washing machine detoxification precautions if there is underlying biotoxin illness. So those of you interested, might want to look that up. But anyways, when I said starting from the kitchen, it's important to start from the kitchen. For example, non-toxic cookware, pots and pans, they need to be non-toxic. It's nowadays, the awareness is very high. So keeping your environment non-toxic, using your household cleaners, personal care products, beauty products, being non-toxic, that is something that is trending very heavily. So there should be plenty of information available on that for those interested. Okay, you'd be surprised the sheer number of heavy metals and toxins in conventional beauty care products. Such a shame. Okay, next, metabolic support, enzymes, different kinds of enzymes, digestive, proteolytic. There are coenzymes like alpha lipoic acid, CoQ10, right? Especially for patients that have additional complications with heavy metals or, panic attacks and cardiac symptoms. Okay, feminine hormonal balance, very, very important. Wives, mothers, women are the heart of a family. It's very important that women are, supported with their hormones, with the hormone balance. Now, here are some individual herbals that I recommend for PMS, dysmenorrhea, and menopausal symptoms. So, little bit of a homework for you, right? Again, like I said, there are no cookie cutter protocols. It's important to have knowledge. You can't approach a patient with herbals blindly, right? If you have a cookie cutter protocol, I would run from it. I would rather study the herb, look at the effect of the herb, and see what it does for that particular symptom that you're trying to help the patient with or infection. Okay, now, some of the herbs that help for low thyroid, hypothyroid issues, lots of them, right? As you can see, I've added some Ayurvedic wisdom to it as well for those of you who are inclined to or knowledgeable about Ayurvedic. And it also explains, it also explains that avoid teas containing lemon balm and blue vervain if your patient has hypothyroid. Hypothyroid is very commonly seen with Lyme disease, right? Okay. Nutrition for hypothyroid. There you go. These are foods that support the thyroid. Obviously, you have to stay within the parameters of your patient if there are any individual dietary allergies, sensitivities, multiple chemical sensitivities, mast cell activation. So that is, again, like I said, it needs to be an individualized approach, but overall information, there you go. There are many foods that benefit hypothyroid. All right, now let's talk about adrenals. Now, with the adrenals, I've given you information on herbals, the Australian bush essence. For those of you who are in Australia, it's best to keep herbs local as much as possible, right? Either that or you grow them, which is what I do, with the BioNexus herb farm. But anyways, for those of you who are into Ayurvedic, for those of you who are yogis, the third and the fifth chakra cleanse and reset is very important for adrenal reset. Okay. Nutrition for adrenal: sleep, fish, flax seeds and oil for those of you who are vegans or vegetarians. Absolutely no caffeine, artificial sweeteners, flavors, processed foods. These will all deplete your adrenals further. It is better to stay on a simple diet with hardly any variety than to add a lot of variety, even if marketed as organic, but the food is processed. For a patient that has adrenal fatigue, simple is best until recovery happens. Often, patients will dramatically improve if you go step by step. And I remember wonderful lady, very, very sensitive. We had to start with 1 drop of everything. Amber, such a sweetheart. I still remember Amber. I mean, I still see her, but I still remember how she was. She's doing remarkably well right now, but so many sensitivities, complete adrenal exhaustion. And I remember the poor lady, all she could eat was very bland chicken soup and rice. Everything else would give her mast cell activation, rashes, histamine, prostaglandin type reactions. Very sad. Now she can eat, pineapple and Thai food. And she can even eat out occasionally, as long as she keeps it paleo or keto. Absolutely amazing. The body is so phenomenal when given the right tools for healing. All right, now, how do we, sorry about that, something just dropped a pen if you heard the noise, but anyways, talk about the extracellular matrix. Let's talk about that. Let's talk about healing the extracellular matrix. One example would be ulcerations, gut issues. Many patients. I remember during mentoring with Dr. Jones, all the patients that he sent for endoscopy biopsy always came back positive for Lyme disease. So we know that, Lyme disease attacks the tissues, the gut, and it is important to heal the gut, right? I've given you one recipe here. Okay, now anti-inflammatory herbs for tick-borne infections. Remember, I'm addressing inflammation first. We haven't progressed. For those of you who are paying attention, I haven't spoken about antimicrobials yet, have I? Because it's a step-by-step. You can't jump the gun and bombard your patient with antimicrobials right at the start. It's not going to work out well in your favor. Anyways, some examples for anti-inflammatory herbals. Let's see what we have next. Here we go. Now, herbs used for Lyme and co-infections at BioNexus Health. These are your antimicrobial herbals. Often practitioners will jump in straight with antimicrobials. Oh, Buhner says use this. Yes, he does. But have you read the whole book and understood it? And have you researched the herbs and understood what they can do? Because most herbs are multifactorial. Okay. So it's important to know your herbs, respect your herbs, know how to dose your patient. First and foremost, know your patient, okay? And actually, if I may, even before that, know yourself. Know the knowledge that you're lacking and gain that knowledge before you start treating a patient with chronic illness. So a long list of herbs that are used for the most common co-infections that I see in my practice, along with the Lyme. So Lyme, Bartonella, Babesia, Ehrlichia, Anaplasma. These are the herbs. Now you notice astragalus, right? You know what? The herbs are in no particular order. Okay, this is just, the herbs that are used. Like for example, astragalus for Lyme is first. Well, it's not the first herb that is used to treat Lyme disease. Okay, so just keep that in mind. I haven't made this, absolutely simple. These are options you have. You as a practitioner have to choose these options and, customize it to your patient. Okay. Now, a wee bit about BioNexus Herbals and Apothecary. For us, BioNexus Herbals, I always love to say that it is literally farm to apothecary table, farm to table. This is farm to apothecary. The farm is only 10 minutes away from the apothecary where medicine is made, and BioNexus Herbals are very high-end, very exclusively handmade, artisanal crafted. We use a triple extraction method. And, I actually prefer to keep it small scale, right? You will notice that BioNexus Herbals are not available on the market because I prefer to keep it that way. Now, we have thousands of patients in 73 countries. And Andrea in the beginning said 50. I think that's the, I might have sent you an old bio, but we have like 73 countries and counting. And we just can't keep up with the demand for our patient population. And, you know, we also have some practitioners who mentor with me, who also stock the BioNexus herbals in their practice because of the spectacular improvements that they've seen in previously non-responsive or minimally responsive patients. So these are absolutely beautiful. We have the capacity to customize remedies for a patient as well, if needed, you know, including imbibing the patient's own genetic frequency into the patient's exclusive herbal mix. So it is a very detail-oriented process. I absolutely love it. Oh, sorry, the slide is a little off track, but you can see just a brief example of the BioNexus herbals. There are many, you know, we have all the way from nasal spray for Marcons, all the way to essential oil support for cleansing the environment, insect bite tincture, tick-borne infection support, biotoxin detox, right, yeast and parasites, and the entire gamut, mycoplasma. Okay, now, co-infections and herbs that can be used, right? We have for mycoplasma and chlamydia pneumonias, for viruses, yeast and candida, immune modulation, brain and nerve support. I will not be speaking much about these. I will just let you know, I have these here so you guys have the recipes for those of you who are interested, right? We know that soft tissue injuries, sprains, strains happen to patients with Lyme disease and biotoxin illness. So here is herbs and oils. You know, Ayurvedically, essential oils and herbs can both be either cold or cooling or warming, or some can be neutral. So accordingly, it is important when you are using herbs and essential oils for the same patient that you are aware of this. So for those of you who are new students, you know, I've given you straight up examples of which herbs and essential oils kind of blend well together. Not blend, I mean, they go well together, right? Essential oils are external, not to be taken internally, and herbs can be ingested, of course, right? So you can see, which was the purpose of putting these recipes in here for you. All right, for relaxing muscle spasms, then for arthritic pain, herbs for autoimmune disease. So Hashimoto's, pandas, what else? Parkinson's, multiple sclerosis. You know, these herbs are also good for neurodegenerative diseases as well. Right, now remember, immune amphoterics. It normalizes the function of an organ or a system in the body. Normalizes meaning, you know, balances. Now, immune regulators, these are immune modulating. So they reduce histamine release and allergic response. Third, it's alteratives. It's not alternatives, it's alternative herbs, which means alternative herbs increase elimination of metabolic waste through the detox organs in the body. All right. Some information on castor oil packs. Right. Medicinal mushrooms. Information on medicinal mushrooms. I know I've been asked this question by many practitioners, so that's why I put some information in here for you. Okay, for dyspepsia and indigestion, home remedies, herbs and oils. This really helps with pediatrics, especially if you're dealing with children with autism, which have a lot of gut issues, as well as underlying Lyme disease and biotoxin illness. All right, constipation. Lots of recipes for constipation. Okay, for hydrochloric acid imbalance and for esophageal reflux, some recipes. Now, this is, I think I'm going to take this slide out. It's very advanced, never mind. All right, antimicrobial essential oils. So, for those patients that have lymph nodes and glands that are swollen, infected, for example, Bartonella patients, often complain about infected and swollen and painful. They don't know it's infected, but we know as practitioners, but swollen and painful lymph nodes around the neck, back of the neck especially. So some examples of antimicrobial essential oils that can be used. Remember, learn about essential oils and remember to always mix the essential oils with carrier oils, okay? Okay, Lyme defense tea, one of my amazing mentors, I learned about the Lyme defense tea for, I have many patients that are ranchers and farmers and grow their own food, they have homesteads and they absolutely appreciate this. Many of them during tick season make like an iced tea pot and they take it to church every Sunday, or it's just such beautiful stories that I hear. Or they'll take it to the local hospital and say, hey, is there anyone with Lyme disease or any chronic illness? Would you like to have one cup of the tea? So anyways, of course, these are amazing formulas for personal use as well. Okay, now Lyme prevention extract, right? This is how, if you are one of those DIYers, this is how you can do that. But remember, keep in mind for New England, Canada, Scotland, Ireland, Baltic states, Ukraine, and Russia, I recommend taking this from mid-February until snowfall. Okay. Digestive detox and respiratory detox. Again, I've given you herbs and their synergistic essential oils. Remember, the essential oils need to be synergistic with the herbs when you use them. Urinary detox, lymphatic detox. Urinary, so many patients of mine come up with, yeast infections and urinary tract infections. What else? These can also actually help with the, what is that? IC, interstitial cystitis as well. All right, now, camel milk. Camel milk is towards the end because that's where it belongs. If additional gut repair is still needed after all of that, remember, the nanobodies in camel milk can increase autoimmunity. Nanobodies are antibodies, okay? And autoimmunity is caused by friendly fire, human antibodies attacking their own organs, correct? So once all the triggers have been neutralized, like examples, the infections, the parasites, etc., once the toxins have been detoxed, gut has been repaired, and you feel that the patient is now ready for extra immune modulation and gut repair, then camel milk comes into play. There is no magic bullet. There's no panacea. People rush to add camel milk, especially unfortunately in the autism community because of a lot of misinformation online. That, oh my gosh, my kid is going to start talking. Why? Because another mom posted, this magic recovery overnight story. Like, really? explain to me the mechanism of overnight magical recovery of speech. How does that even happen? With all of the knowledge that, at least the knowledge that I have of the immune system, of the brain, what areas in the brain are affected, about genetics. I simply don't understand how an overnight magical miraculous cure works. So please don't go for that. Please exercise due diligence. Okay, just some information about camel milk. It is very different from cow, sheep, goat milk. It's actually similar to llama and donkey milk. Now, llama and camel milk nanobodies are being studied for cancer as alternative treatments for cancer. So they are very anti-inflammatory, very repair-oriented when used correctly. Okay. International Forum for Camel Advocacy and Medicine. I'm on the board. I'm one of the founding members, actually. Okay, so in conclusion, I'm sorry, that was a lot of information. Actually, I'm not sorry. I think it's important to have all that information, right? So that was a lot of information. I hope it was useful, educational, inspirational, even for those who are listening in today. So in conclusion, natural herbal medicine is absolutely a viable option for treating tick-borne infections. So once again, thank you for having me. And I'm happy to answer any questions. In fact, one of the things that I suggested was, if any practitioners are interested, I'm happy to do a Q&A session as well. So namaste. Thank you and be well.
Oh, that was absolutely fantastic. And I think you're absolutely right. We needed to give the big, broad overview. There wasn't too much information. It's showing the scope and the breadth and the complexity of this. I have certainly had many of the clients, the Bell's palsy, the Marcons, I've seen all of it. And as you say, the pyroluria, huge thing to mention there. I've no doubt people are going to want to go and check out your podcast. So I might link that as well. I'll grab, you said it was the BioNexus podcast, I believe.
Yes, it is. Last year, several of my patients requested that I share recovery stories.
Right. Yeah.
Right. Because, especially because of the pandemic, morale was at an all-time low for people with chronic illness or, families of children with autism. There was a lot of depression, anxiety. So I said, okay, let me start. So I just started a few months ago, and it's just been, I hear from people, it's been very inspirational, very supportive of their healing journey. And I'm just happy that I did. Now, so there are wide variety, and it's a wide variety of topics, but it's on YouTube, it's called as BioNexus Health USA.
Okay.
And it is also on Podbean, like Mr. Bean, like Podbean. Mm-hmm. So it's on Podbean. BioNexus Health USA would be the name of the channel again.
Excellent. No doubt we will be checking that out. And the recipes. Thank you for considering to include that. I think for any person who's relatively new to all of this, just to get familiarized themselves with some of the recipes as well would be a really nice place for them to start.
Oh, absolutely.
Yeah. So thank you so much. I've no doubt this is going to be of tremendous value to our practitioners and their journey going forward within their career. So I want to remind everybody that this presentation can be viewed in the NANP members area, along with a vast selection of cutting-edge webinars. As mentioned, each webinar includes a corresponding quiz, which is worth one continuing education unit. So if you have an interesting topic that you would like to present, or if you know any speakers that you would like us to host, please feel free to reach out to me by emailing me, andrea@namp.org. So that brings us to the end of our discussion for today. Thank you for listening and enjoy the rest